All righty, once again, I welcome you to the January monthly webinar for the Virginia Senior Medicare Patrol. Today, we're talking about the art of the scam, understanding the coronavirus scams, why they work, and how to avoid them. My name is Sean Smith, and just as we get started, I'd like to go over today's agenda. So we're going to talk about the structure of scams, some examples of scams, talk about why the scams may be working, and then what you need to know about them to prevent, detect, and report them. And then we're going to have a question and answer period. We're going to do our questions and answers by a couple ways. One, throughout the program, if you want to type in questions that you don't forget into the Q&A, not the chat, but the Q&A icon, please do that and we can answer those at the end. But also, if you raise your hand once we get to the question and answer section, I'll unmute you or allow you to unmute yourself and you can ask your question live. So we'll, again, talk about structure, some examples, why the scams work, and what you need to know. All right, my name is Sean Smith again. I'm the state director for the Virginia SMP. I'm a Virginia native. I was born in Hampton Roads. I grew up a good deal of my life in the New York area and came back to Virginia around high school. I graduated from York High School, attended Longwood University where I majored in biology. And my very first job out of college was in pharmaceutical sales. So I sold pharmaceuticals for Roche Laboratories and realized I really hated sales. And answering a call in my life, I actually went into the ministry. I'm an ordained minister, and I studied Christian counseling, and I ran our church's nonprofit. After some years of that, my church went through some changes, and I decided to leave church and went back into the corporate world where I was served as a vice president for an event production company. After some time there, I realized I really wanted to get back into some human services work. And I secured a position at Goodwill of Central and Coastal Virginia in their mission department as their regional director for workforce development. And so I worked with individuals from marginalized communities, helping them to prepare for work, to find work, and then help them maintain that employment. I ended up here at the Virginia Association for Area Agencies on Aging about 6 months ago, July 20th, as a matter of fact, so it's exactly 6 months ago. And it really matched up to where my heart is. I'm really passionate about advocacy, which is, speaking up for people that can't speak for themselves, but also empowerment, which to me is teaching them and giving them the skills so that they can speak up for themselves. And as we look at the SMP mission, which is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. It felt like a really good match for what I love to do and what I hope to impart in not just this session, but all the training sessions that I do. It's one thing to teach you about every scam that comes along, but I'd rather teach you about scams themselves so that regardless of how the scam changes, you can avoid them. So we're going to talk a little bit about some of those things today. Just some background on the Senior Medicare Patrol. It is a program that's run through the Department of Health and Human Services in a division called the Administration for Community Living. They have a grant for the Senior Medicare Patrol, and the grant in the state of Virginia was secured by the Virginia Association of Area Agencies on Aging, which is the parent association for all of the AAAs in the state of Virginia. So the V4A is the parent agency for the AAAs across the state. As far as the SMP goes, there are SMPs in 50 states and 4 territories. So all across the nation, we have SMP programs. All of those programs are supported by paid and volunteer staff, and they all conduct educational training sessions like this one. Each state also hosts its own fraud hotline, very much like we do here in Virginia. In Virginia, the SMP, we partner with 22 of the 25 AAAs, and we sponsor local and state events. We are sponsors and vendors at some of those events, especially when we're out in the field. We also attend conferences and seminars as presenters, and we also conduct educational training sessions, again, like this one, virtually or in person, or we customize those. So we're going to get started with the presentation. Again, looking at the structure of scams. We're going to talk about examples of some of those scams, why they work, and what you need to know. And then we're going to go into a question and answer period. The presentation will last about 45 minutes and then about 15 minutes for questions and answers, in case you're wondering. So let's talk about scam structure. In most of the phone scams that people are experiencing, especially around coronavirus as well as other scams, the structure pretty much looks the same. There's the actual call, there's actually an opportunity where the scammer is trying to gain your trust. They're going to tell you a story, and then they're going to make a request from you. And that's pretty much how scams work. So on the call, they ask, how do I get this person, or how do I get you on the phone? And then once I get you on the phone, if I'm able to do that, how can I gain your trust to keep you on the phone? And if I can keep you on the phone, then I can tell you my story. And my story is designed to make you take action. And if I can get you to take action, then I'm going to make my request to figure out how much I can get out of you. So what can I get from you if I can get you on the phone, keep you on the phone, tie you into my story, and make my request? So let's look at getting you on the phone. Again, they're asking, how can I get this person on the phone? So we know most of these calls that are coming in as scams are coming in as unsolicited calls, meaning it's a call that you didn't previously talk to someone about. It's going to be someone that you just simply do not know, and they're going to call you. Now, in the past, we see a number that pops up on our phone that we don't recognize. We should just pick it up. But now we've gotten smart to realize that, you know what, it's probably a scammer or a salesperson. I'm not going to pick it up. So what scammers have started doing is manipulating the caller ID on the telephone, so it looks like the call is coming from someone that you know or a trusted source. So what pops up on caller ID could be the name of a hospital, or it could say that it's from Medicare, or it could be from some other trusted source. Well, we've gotten smart to that. We've gotten hip to that, saying that, okay, well, I'm not going to fall for that again. And so what they also have figured out how to do is use a spoofed number. Now, a spoofed number means that they could be calling from anywhere in the world, but making it look like the call is coming from your neighborhood. So it'll have your same area code and maybe your same 3-digit exchange. And it makes you think, well, maybe that's somebody I actually do know. Maybe it's someone from around the corner. Maybe it's my friend. Maybe it's my doctor's office. But again, they're trying to anything they can to get you on the phone. And so they'll use a fake caller ID, or they'll spoof a number. With a spoof number, what happens is once they use that number and you try to call it back, you're actually calling someone who's probably pretty local to you that has no idea why you're calling them. And you go in this back and forth of saying, well, you just called me. Well, no, I never called you. But again, that number was spoofed. That could be any scammer from anywhere calling you on that number. So let's say you get spoofed, you end up picking up the phone. Once they get you on the call, they're going to do their best to try to gain your trust. And so they'll do that first. One way they'll do it is by saying that they're representing some trusted agency. So it could be, again, Medicare, it could be the Social Security Administration, it could be the health department, but they're going to say something that's going to compel you to think, oh, wow, let me listen to what they've got to say, because they're someone I trust. If they don't give you the name of an agency, they might give you their title and tell you and make it sound like a very trusting title. So they'll say something like, hey, I am with the health department and I am the community outreach advocate, or I'm the patient advocate, or I am a community liaison. But they're going to give you some type of name to make you think, oh, this is someone I can trust. I should probably hear out what they've got to say. They're going to sound very calm and pleasant in their demeanor, and they're going to sound like they're doing you a favor. So they're going to be really nice on the phone. And the first thing you're going to think is, wow, this is something that I should probably listen to. If they get past you in gaining trust, then they're going to start telling their story. And the key part of their story is really to elicit an emotional response out of you. So with the coronavirus, a lot of times they're simply playing on either your fear of the virus or for your desire to protect yourself. And so they're going to tell you a story that's going to play on one of those two things. They're either going to try to figure out if the virus scares you, or if you are desperate or excited about doing something to keep yourself protected. But the whole idea is to really try to elicit some type of an emotional response out of you. Once they get that response, again, they're trying to compel you to take action. So they're going to get that response out of you, and then they're going to start asking you for stuff because they've got you at the place where you're ready to take some action. And so they're going to ask you for your personal information, your Medicare number, your insurance information, your Social Security number. They go down those things because those things can be very valuable to them. Your Medicare number can be used to bill Medicare where they would get paid for not doing anything at all or doing very minimal. Same thing with your insurance information. And of course, with your social security number, they can steal your identity, open up credit cards in your name, open up bank accounts in your name. But again, they need that information because it's valuable to them. They can utilize it. If they don't ask for that information or they can't get it out of you, it's possible they may ask for money directly. So they may ask for your banking card or your credit card information, your banking information. They may ask you to wire transfer money to them, or they may ask you for some elaborate scheme of how to get money off or on a gift card. And so either way, they're again trying to compel you to take action by eliciting this emotional response and then making a request from you so that they're able to get what they want out of you, something of value to them. Again, that personal information or that money. So again, there's a call where they try to get you on the phone. Once they get you on the phone, try to gain your trust, weave you into their story so they can elicit this emotional response and compel you to take action. And once you're ready to take action, then they make their request and try to get information out of you. So we're going to look at some examples of some coronavirus scams. And what I want you to see in these examples is they all follow the same type of structure. They all follow the same structure. And the thing that changes is the story. And the reason the story changes is because it requires a different response out of you. But the story is what changes. And only because the story changes is how scammers are able to quickly to manipulate or change the scam to dupe more people. So these are actual scams around testing. These are the things that these are the calls that people are receiving around testing. First, it starts again with an unsolicited call. People that they don't know or think that they might know or not sure that they know at all. And in order to gain trust, they get on the phone and they tell the individual, I'm with Medicare or the hospital or the health department, or I'm with some testing facility. And the story they start telling is, one, they say, I can register you for a test at a local test site. I can do this, and I can do it free of charge for you if you provide me with XYZ information. Or they might say, I can send you a home test kit, and I can do that free of charge to you, especially if you're on Medicare, if you have this insurance or that insurance, and if you give me your information, I can get that to you. Or in addition to a COVID test, I can also send you a genetic test or a DNA test. And again, this is not going to cost you anything. Well, of course, with these types of stories, if you're afraid of the virus or you're really anxious about protecting yourself, you might fall for this. And what compels you to take action is them telling you that, hey, Medicare is going to pay for it. It's really not going to cost you anything. You just have to give me your Medicare number or your credit card number or some type of social security number, because really that's all they want. You can give that information to them and really none of these things you'll get in return. So those are what testing scams, some of the testing scams that we've been seeing. We've been seeing scams around personal protective equipment. And this again is what it looks like. It's an unsolicited call. And in order to gain trust, the caller is saying that they're with Medicare, health department, or medical supply company. And what they're promising is that they can get you masks or disinfectants or gloves or sprays or anything that they can pull you in with. And by telling you that it's the greatest thing in the world, it's better than anything you can buy in a store. It'll keep you safer than anything else that you might be able to get anywhere else. And so if you're afraid of the coronavirus and afraid of catching it, a lot of people fall for that because they're thinking, well, yeah, probably what they have is going to be better than what I can get at Walmart or Target. And so because you buy into that, they say, I can get it to you free of charge. You get the best thing on the market free of charge. Go ahead and just give me your Medicare number or your credit card or your social security number. And so again, that story is really what pulls people in and gets them to make decisions as part of this scam. And then finally, we've been seeing some scams around the COVID vaccine. Coming in as unsolicited calls, again, from trusted sources, hospital, health department, even pharmacy or pharmaceutical companies. And what they're telling beneficiaries is that they could send you a vaccine pill or some type of vaccine prescription. They've approved the vaccine. Now I'm going to send it to you in a pill or a prescription. And if you give me your Medicare number, I can get that to you. Or they're saying, you can get early access, and I can get you early access to the vaccine. You just have to pay to allow me to put you on the list. So you have to pay for that access. Or they're calling and they're saying, you are required to take the vaccine, and I have to get you registered. I'm going to need your Medicare number. Oh, finally, one of the things that we've been hearing is that people are calling saying that you are eligible to be a part of a vaccine trial, and the vaccine trial pays XYZ. I just need to register you as a Medicare beneficiary, so I need your number to make that happen. But what I want you to see, again, as you see, all of these come with the same type of structure. There's a call, there's a gaining of trust, there's a story, and there's a request. And so they're all the same, and you ask yourself, so why do these scams work? And the scams work for just a few reasons. One, basic knowledge. People have lack of knowledge about the subject matter. So you don't know about the coronavirus vaccine, you're afraid of it. Your fear is probably born out of not understanding how to protect yourself. Or you don't understand how Medicare works or how trials work, but not having understanding or knowledge about the subject matter is one reason people fall for it, but also simply not having knowledge about the scam. If you don't know what the scams look like, what to expect from a scam, then of course it makes it a little bit more difficult to avoid them. The other reason it works is our emotions. Scammers play on our emotions. And when we're emotional, a lot of times we generally make bad decisions. I think about all the times that I've been angry and I've yelled and I said things that I didn't want to say. I've slammed doors, I've run out of rooms. When we get fear, we get into that fight or flight mode where we feel like we got to make a decision now and our life depends on it. And so we do those things quickly. And a lot of times those decisions are just bad decisions. I have two kids. When my kids were young, one of my kids, for sure, at some point needed a spanking, or mom was with them and he needed a spanking. And then he looks at mom with those big puppy dog eyes, and mom gets all soft and mushy because he needed a spanking, but because he gave her that look, she's real sad now, and she doesn't make the right decision, which is to spank him. She makes a bad decision, which is not, and he gets away with it. And so generally when we are emotional, we just make bad decisions. Scammers play on that, and then they pressure us to make a decision. They start to tell us things like, well, I have these supplies. If you don't make the decision now, they're probably going to be gone next week because these are the best things going. Or there's only a few more spots left on this list. If you don't do it now, then you're going to be out of luck because we won't have any more spots left. Or, you know, if you don't get this test right away, you're going to find yourself in a line that's 2 weeks long. So let me get you on the list now. But they start to pressure us. And when we're emotional, we're ready to make a decision, which is probably going to be bad, then they keep pushing on us to get to that decision. So those are three reasons why it works, why the scams work. And people fall into that. A lot of people, because they're emotional, they live in an emotional state of loneliness, sometimes state of grief. They respond to those things and they end up making a decision that's not going to be good for them. So let's talk about what we need to know. And the first thing I really want to talk about is we talked about knowledge of the subject matter and the knowledge of the scams. I want to talk a little bit about knowledge around the coronavirus. Some of the stuff you've already heard, but sometimes you just need to hear it again to make sure that you understand what's important and what you can do to keep yourself safe. So how to stay safe from the coronavirus, some facts. Wear a mask. One of the most effective ways of keeping yourself safe from the coronavirus is wearing a mask. It protects you, it protects other people. Are they 100% effective 100% of the time? They may not be. However, it's the most effective way that you're going to find, other than, of course, not coming in contact with anyone who has it, which is the second one, social distancing. You want to stay at least 6 feet away from individuals, especially those that don't live with you. So if you're out and about, keeping a distance and wearing a mask, again, is going to most likely keep you safe from the virus, which means avoiding crowds. The more people that you're in contact with, of course, the higher the risk you are for catching the virus. And then finally, good hygiene. Washing your hands often and then making sure you're not touching your face or your eyes. So we all know this. Let's look at some practical things. So staying safe, some practical tips. Just so you know this, if you live alone, you don't have visitors, and you don't go out, it's highly unlikely that you're going to catch coronavirus. So there's nothing super difficult to fear there. If you live alone, you don't go out, you don't have visitors, you're not going to get the virus. Highly unlikely. You can open the windows, it's not coming through the windows if there's nobody out there blowing it in. That's not going to knock on your door and ask to come inside. You can go out in the yard and do things in the yard. You can sit on your porch and watch the families walk by. You're going to be safe from the coronavirus. Again, if you're living alone, don't have visitors, and you don't go out. If you have visitors, if people are coming to your house, family, friends, repair people, there's some things you can do to keep yourself safe. One, insist that they wear a mask. Insist that they come in and wear a mask. People will say, oh, I don't need to wear a mask because I don't have any symptoms. I don't have the virus because I don't have any symptoms. That's not always true. There are people who are asymptomatic that have the virus and can spread the virus even when they don't have any symptoms of their own. And so you want to insist as they're coming by your place that they need to wear a mask. If they come in, social distance with them. Let them sit on one side of the room while you sit on the other side of the room, and you guys can still have a conversation and do what needs to be done. Also, limit their movement in your house. So we know that the coronavirus lives on some surfaces. And so if they're moving all through your house, then of course you don't know exactly where they've been and what they've touched. If you limit their movement, saying you can go in the living room and the bathroom, then you know that once they leave, you know exactly where you need to clean to keep yourself safe. So you want to limit their movement if possible, and then thoroughly clean up after them once they leave. Let's say you have to go out for whatever reason. Grocery store, pharmacy, any of those places, you want to choose a time that's going to be less crowded. If I know some grocery stores have a reserved time for seniors. My neighbor and his wife are both seniors. He goes to Publix in my neighborhood at 7 o'clock in the morning on Tuesdays because they reserve seniors in that particular time slot. And he knows that he can show up there. It's only going to be another bunch of seniors who are going to be trying to keep themselves safe. When he goes out, or when you go out, wear a mask. Mask up regardless of the situation. And then also social distance. When you're in a place where other people might be, you have to watch. Some people just don't care. They're not wearing a mask, they're not social distancing. So you want to watch out for those folks because those are going to be ones that are going to be the most danger to you. If they're doing it in that space, they've done it in other spaces. And so even though you're trying to keep your distance, not everyone is trying to keep their distance. So you have to watch out for other people. And then finally, wear gloves or wash your hands often. I keep hand sanitizer in my car. So as soon as I get back in my car from wherever I've gone, I'll squirt up a little bit, wash my hands off, put in my key, turn on the ignition, and drive away. And then finally, the question comes up a lot, are delivery items, are they safe? They are safe, but there's some things to do to keep yourself extra safe. So if you're ordering something, use whatever kind of contactless payment method that you can. Most often, if you're ordering online, you can do all of that online. If you're ordering by phone, they may have to hand you a receipt. You want to avoid that if you can, but take precautions if that's something that you have to do. Have people deliver those things to your front step or your porch. Tell them to leave it there, knock on the door, and go away. And then you can watch them go away, pick up those items, bring them in the house. If you're concerned and it's a non-porous surface like glass or plastic, say you ordered groceries and you have cans or items like that, feel free to wipe those things down before you put them in the cabinet or your fridge. And then finally, paper bags or anything that those items have come in, go ahead and trash those items once you finish unpacking them. And again, these things will just help keep you safe a little bit. So again, practical tips around the coronavirus, hopefully to help keep you safe. Let's talk about the scams. So first, the coronavirus scams, the testing scams. As I shared earlier, people are getting calls where people are saying, I can register you for a test in your local area or at one of the local test sites, or I can send you a home test kit. Or they might say I have other genetic tests I can send you as well with the coronavirus kit, all free of charge to you. So the truth around these things is, one, no legitimate organization is going to call you with an unsolicited call. They're not going to call you to register you for a test. They're not going to call to mail you a test kit. No legitimate organization is going to call you unsolicited. Now, are there test kits out there that you can get? Yes, but you'll have to do the first reach out to get it. Are there places that you can register for a test? Yes, but you want to make that first reach out. You don't want to get that stuff or that information or sign up for those things for someone who calls you first unsolicited. Also, what we've seen is when people go to some of these test sites, the people at the test sites will offer them other tests. Well, since we're taking your blood or since we're taking this swab, we can also do a DNA test on you, or we can do a genetic screening to make sure you don't have a marker for this heart disease or this liver disease. You always want to decline those opportunities. It sounds really good. They'll tell you Medicare is going to pay for it, but oftentimes Medicare does not, especially without a doctor's note. And so you end up paying for it, and they are very, very expensive tests. So when you go to a test site, you always want to tell them all you're here for is the COVID test. I'm not here for any other test. And then you want to look at whatever paperwork they give you to sign to make sure you're not authorizing them to do any other test. And then finally, you shouldn't have to pay for a COVID test. In most cases, Medicare and your insurance company will cover that test. You shouldn't have to pay for it, the testing as well as the administration fee. The next scam we want to look at are scams around personal protective equipment. Again, we talked about people saying, I can get you the best mask, or I can get you disinfectant that is 100% effective against the coronavirus. I can get you gloves that are going to be thick enough to protect you, or all kinds of sprays, all free of charge to you. Again, you should never seek anything from someone who gives you an unsolicited call. You don't want to believe any of the claims they're making about the products that they're purporting to be able to give you either. So you don't want to follow down that road with them because there's an unsolicited caller. You don't know who that is, and they're going to tell you anything they want to tell you to try to get that response out of you so they can get your money and your information. If you need something healthcare related, you should always contact your healthcare provider, whether it's your physician, the health department, or a pharmacist. You want to reach out to someone that you know and that you trust, and then they can either get you what you need or get you connected with the proper source so that you're getting something legitimate and you can avoid the scam. Then when it comes to coronavirus vaccine scams, again, people are saying they can give you a vaccine pill or prescription. They cannot. There is no pill or prescription for the vaccine. They say they can get you early access or register you to put you on a list for a vaccine. They cannot. There is no such thing as an early access list or registration list for vaccines. They say that that you can be required to take the vaccine. No one is going to require you to take the vaccine. You are never going to be required to take it. That's going to be your choice. And then no one from a trial company is going to call to determine if you're eligible for a trial. If there's a trial going on, that information is going to come through your physician because he's also going to be involved. So again, no one can ship or sell you a vaccine. You cannot pay to get early access for the vaccine, and you shouldn't have to pay for the vaccine at all. And then of course, no one is going to require you to get the vaccine. So those are the things that we need to know to avoid the scams if they come through a phone call. So at the S&P, we talk about preventing, detecting, and reporting scams. And we're going to go through a short list here of things that we can do to prevent scams, some things that we just simply need to know to prevent scams. One, we should always be suspicious of unsolicited callers. I like to say that an unsolicited caller is equivalent to someone just walking up to you on the street. If someone walked up to you on the street and told you they could get you the vaccine, you would be like, who are you? Why are you even talking to me? It's like a stranger just walking up to you and really kind of invading your space. So when you get one of those phone calls from someone you don't know and they start talking to you, again, it's equivalent to to someone walking up to you on the street. It's an unsolicited call. 90% of the time, an unsolicited call is either going to be a salesperson or a scammer. Someone is calling you to make a sale and sell you something, or someone is calling to scam you. 10% of the time, an unsolicited call actually may not be unsolicited at all. It may be a legitimate call. It may be your pharmacist calling, or your doctor calling, or a legitimate source that is trying to get connected with you. That 10% of the time, they're going to leave a message. I just finished my yearly annual checkup, or I was just gotten through that process. But during that process, I had to renew my medications, my prescriptions came in, and I started getting calls from my doctor's office. I got calls from my pharmacy, and I didn't recognize the number, so I let it go to voicemail. They're all good. Any legitimate source is going to leave a voicemail. They're going to leave a message, so you're not going to miss anything. So if it's a number you don't recognize, if you don't pick it up, if it's legitimate, they're going to leave a message. So 90% of the time, sales or scam. 10% of the time may be legitimate, but they're going to leave a message. 100% of the time, an unsolicited call is from someone who wants something from you. If they're calling you unsolicited, they want something from you, and you have every right to be suspicious. You have every right to question the legitimacy of that call. I have an 18-year-old who's in college, and he and I communicate typically weekly by text. He'll text me, I'll text him, all hours of the day and night. He's sending me texts, showing me things. I know that when I start getting a phone call from him, he wants something. And while it's my son and I welcome the call, it's not like it's one I don't know. I know that he's calling because he wants something. And he almost goes down the same kind of structure of a scam. He'll try to butter me up. Hey, Dad, how are you? It's been a great week. Did you have a good week? Oh, Dad, my grades are doing great. So he's telling me all this stuff. And then he starts with the story. Well, Dad, you see what's happening is blah, 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 blah. And then he gets to the request. So I'm going to need to use about $100 on the credit card. Again, it's unsolicited, and 100% of the time, he wants something from me. So when I see the call coming in, I'm like, oh Lord, he wants something now. And I'm ready, I'm suspicious. Anytime I get an unsolicited call, that same mental process happens. Next, we all know this, treat your Medicare number the same as your Social Security number and a credit card. That Medicare number is valuable. It's your gateway to the services and the benefits that you have through Medicare. If you give that number out, then other people can use those benefits. Other people can gain the access to the services that you have. So you want to protect that the same way that you would protect a credit card. You would no sooner give your credit card number to a stranger than, and you should not use your Medicare number any differently. So that number can be valuable. And if someone else is using your benefits, then it limits your benefits on that card. The other thing you need to know is that government agencies generally will not call you first, especially the big three. The big three would be Medicare, Social Security Administration, and the IRS. They are not going to call you first. Now, there are a couple of exceptions that you need to know about. Medicare in this year is actually doing surveys by phone. And so they will call you and it will be unsolicited. However, they will not ask you for personal identifiable information and they will not ask you for money. If they say they're calling for Medicare and they're doing a survey and they start asking you for stuff, it is a scam. And so don't fall for that. But again, generally the big three won't call you. The only other exception there is that the health department may call for contact tracing. If you've been identified as someone that's been in contact with someone who's had the coronavirus or been exposed to it, then they may put your name on the list and call you as a contact tracer. In either of those two situations, whether it's Medicare for the surveys or contact tracers, you should be able to ask questions, hang up the phone, and be able to call back to verify the fact that they are actually the legitimate source that is calling you. Again, neither one of them should be unsafe calls because they're not asking you for money and they're not asking you for your Medicare number or any kind of information where they could steal your identity. Next, you should always keep a record of your medical appointments, and we'll talk about why that's important in a moment. But you should always write down the date of your service, who your physician was, when you visited them, where you visited them, what was the services that you received, and you want to hold on to that so you can compare it to your MSN or your other documents. Again, if you need anything healthcare related, don't wait till someone calls you first. Reach out to talk to a medical professional and say, hey, this is what I think I need. What's the best way for me to get this? A lot of times people fall for DME scams because the person on the other end of the phone talks them into like a knee brace or a back brace. If that happens, hang up the phone and call your doctor saying, hey, you know, I really think I need a knee brace. And then they can work you through the system to get that piece of device that you need from a more legitimate source, certainly not from someone who calls you unsolicited. Again, never give out personal information over the phone. So I just heard this week that there's scams going on where people are saying that they're calling from your physician's office, and that for whatever reason that your Medicare number didn't go through. Can you give me your number again so that I can put it through so that Medicare will pay for your service? That is a scam. What we know is that when you go to a physician's office, they actually take a picture or copy of your Medicare card and number. It's not something that you transmit to them verbally. It's not something that you transmit to them in writing. They actually have a copy of your card. So if they have trouble with it, it's not because that they've got the number wrong. It's because it's not going to be for any reason such as that. So they should have no trouble with it. But they're certainly not going to call you to give that information over the phone. If they want that information over the phone, say, hey, you know what? I've got an appointment in 2 weeks. I'll bring the card in at that time and give you that information. But you don't want to share that information over the phone. That, again, is a scam that's going around. We heard about it. It was put out yesterday. It wasn't in Virginia just yet. I think it was in Kentucky. However, we know that once these scams start, they start to spread out if they start to work. So don't fall for that. And then finally, we know most of the scams that are perpetrated by phone calls are also perpetrated by email and on the internet. So if someone sends you an unsolicited email from a source that you don't know or that you're unfamiliar with, do not click on links, do not click on attachments. If it looks interesting for whatever reason, get out of the email and then search for it on the web without clicking on a link or clicking on an attachment. So again, those are some ways to prevent scams. Detecting scams. You always want to review your Medicare summary notices and your explanation of benefits regularly. You want to look at those things all the time. They're going to have information on there, and this is what you actually compare your tracker to. So we talked about earlier, writing down the services that you receive when you go to the doctor, making sure you're making a record of all of that. You compare that record to your Medicare summary notice or your explanation of benefits. And what you're looking for are things like services that you didn't receive or things that your doctor didn't order. They'll show up there. They'll show you all the services that Medicare is paying for, how much they paid the doctor, and they'll show you what services that your doctor ordered. You're going to look for things like double billing. Did they bill me twice for the same thing? Or whether billing looks inconsistent with the services you received. So I'll tell you what that means. I had a young lady call me last month who has a routine procedure done every 3 months. It's called a cystoscopy. And really it's just a looking around to make sure there are no problems based on some previous problems she had. So for months, she's been getting this procedure done every 3 months, every quarter. And usually she sees it on her MSN. She usually costs Medicare about $300. They usually bill about $300. Medicare pays something like $200. So this one time she went, she noticed that they instead of having a cystoscopy, they had cystourethropy, which means that they took something out. And she's like, well, that's not the service I had. And then she noticed that they billed Medicare over $2,000 for it. So of course she was concerned. She's like, that's not my service. That's not what happened. Long story short, she went through the system with Medicare, called the SMP. We worked through the system. What we found out is because this is such a routine surgery for her, when they went in, they actually found something and they took it out. The doctor billed accordingly, but he never had the conversation with the patient to tell her that we had to do something different this time. When she was under to get this procedure done, they weren't going to wake her up, ask if they could do it, and then put her back to sleep. They just did what they needed to do, put it in the notes. And so when she complained to Medicare, Medicare requested the notes, the doctor was able to produce them, and we realized that, oh, the doctor just never had the conversation with the individual. However, the young lady would not have caught that had she not been comparing her MSN to her records. And so we gave her kudos for that because, of course, those are things that she needs to know. And of course, it changes the practices that the doctors are doing to make sure that they follow up the patient appropriately. When you on your MSN, it's going to have things like your physician's locations and the service locations and where you went. Again, you want to look at that information as well as looking at the prescriptions and the pharmacies of the locations that you go to. All of those things, all of that great information is going to be on your MSN and your EOB, and you want to look at that. And when I arrived here in July, I got a call from a young woman by the name of Mary. And she was telling me that she usually goes to the pharmacy and picks up a prescription. It costs her about $48 a month based on her prescription drug plan. However, when she went in June, it cost her $200. So when she questioned the pharmacist as to why, the pharmacist says, well, you've used your entire drug prescription benefit. And so now you're falling into the coverage gap and you have to pay full price. So when she got home, she pulled up all of her MSNs and realized that since January, someone had been using her Medicare number to get prescriptions. And every month they would get more and more prescriptions, some of them even narcotic prescriptions. And this was taking place in Louisiana. Mary lived in Virginia, and someone in Louisiana was using her Medicare number to get prescriptions. So now the problem for Mary is that we've put everything into a case and it's under investigation, but until this investigation is complete, Mary has to continue paying $200 a month for her prescription. Had she looked at her MSN in January or February, she would have seen these charges on there that she wouldn't have recognized, and she could have stopped it back then and there. She could have put a hold on her Medicare number, or they would have given her a new number so that they could run her clean through the system and that other people couldn't be using it. But now she's waited and she had been paying attention, and now she's into a coverage gap that she's got to make up for until they figure out, until they complete this investigation. And that could be 2 months, it could be 6 months, it could be a year down the road. And so the message is making sure that you're keeping a record of what services that you're receiving and that you're looking at your Medicare summary notices on a regular basis to detect those scams that may already be taking place. And then finally, reporting scams. Call the Senior Medicare Patrol. Our number's there on the screen. We are here to help you figure out whether it's an error, whether it's fraud, or whether it's abuse. And the other thing that we do is we triage the information. So that means helping you figure those things out, whether it's errors, fraud, or abuse, but also helping you get whatever it is resolved. So we're able to get on the phone with you and we can call Medicare with you. We can call the insurance company with you. We can call the provider with you if that's something that you require. We can also call on your behalf and we can work with them to get information and then report back to you and let you know what you need to do. Because of the resources that we have and the understanding that we have of the different types of fraud or errors, we can also get you in touch with the proper resource without you going through 100 different phone calls, getting bounced around from place to place. And that's part of our role, is to figure out, what do you have going on? Do you need to call the health department? Do you need to call the Bureau of Insurance? Do you need to call the board for the medical board for this particular physician? Do you need to call an ombudsman? And so we can help you figure those things out so that you get to the right source right away. But the whole idea is to figure out, is it an error? And what do we do to fix it? Is it fraud? How do we go down the road to get those things investigated? With that said, I'm going to go ahead and open up the floor to questions. And again, like I shared, you may put some questions in the chat, but also if you just want to raise your hand, if you have a question, I can take you off of mute and you can ask your question live. I don't see any hands going up, so I guess I did a decent job. I do see a hand from Miss Jackie. Jackie, I'm going to, let's see. I'm going to allow you to unmute yourself and ask your question, Jackie.
Hi, Sean. Can you hear me?
I can hear you.
Wonderful. Well, thank you so much. This was really helpful information, and it really reiterated a lot of good points, especially for those that are spoofing government agencies. I found this very helpful. For anyone that's listening, my name is Jackie Weisgarber. I'm a public affairs specialist with the Social Security Administration. Sean, again, this was really great. I just want to comment, to kind of piggyback on what you were saying about the spoofing. Some of you may have seen a call from our 800 number. Social Security's 800 number is very well known, which is 1-800-772-1213. If you call that number, you know that you are calling an official Social Security number. That is our official toll-free number. However, keep in mind, if you see that number come up on your caller ID, you cannot necessarily trust that that is really Social Security. So Sean, you shared various schemes and different types of scams that are going on. That's one of them. The spoofing is pretty widespread, unfortunately. And also, I just want to share, Social Security employees do contact members of the public. You know, generally, if there's a problem or an issue, though, Social Security always mails the individual a letter. So, you know, we will contact individuals if the person has requested a call or if there's that ongoing business. So if you get a cold call, you know, as Sean was saying, you know, unsolicited calls are not as common unless it's from a salesperson or, you know, or a scammer. So just be very careful. If ever in doubt, hang up and give us a call. Our local phone numbers have been made public. If you're trying to get in touch with your local SSA field office in this part of Virginia, I'm based in Richmond. We have 24 offices. We call this Area 6. And I cover outreach for Social Security in Central and Southwest Virginia. So if you're trying to get in touch with your local office, depending on where you live, you can find that information on our website. So you can call Social Security directly to ensure, you know, make sure that if we really called you, you can find that out to confirm. And as you can imagine, this is very challenging for so many, obviously the public, but also for real, you know, government employees trying to assist the public. So thank you, Sean, again for this very helpful information.
Thank you, Jackie. I appreciate you jumping on and sharing that. That's good for us to know, and it's good for me to be able to share that as well.
Thank you.
All right. Are there any other questions or other comments? Make sure there's none in the Q&A. Great. All right. Well, seeing no other hands, one, I appreciate you all joining this month's webinar. We will conduct monthly webinars every third Wednesday of the month at 1 p.m. The new topic will go out this coming Friday. We're going to look at general scams and general schemes and just really talk about on the next call or next webinar about how to just identify what a scheme looks like, as well as understanding how we fall into schemes ourselves. And so again, that invitation will begin, will be going out this week. Please visit our website at virginiasmp.com. We'll have a copy of this recording also on our YouTube page. You can get to that information or get to those places from our website. Also, keep in mind that we do a monthly newsletter. You can subscribe to that from our website. And if you want this or other types of presentations around healthcare fraud or healthcare schemes, we can do those things in a virtual format for your local civic group, your church group, or any group that you want to pull together. And we also are sponsoring community outreach events. So if you have an interest in participating in one of those events or wanting us to be a part of that, as they come back online, I understand a lot of folks aren't doing those things now this time of year, then just let us know. And again, I thank you all, and I look forward to participating with you all again soon. Hope you all have a great afternoon.